as we go. If you don't mind holding off in your questions until the very end, just because I will go through a lot of thorough information. But before I get started, could you guys like quickly put into the chat maybe some questions that you may have about the injections or the weight loss medications that are being used? I just kind of want to have like a little filter, based on what people are learning, not learning, wondering about. Are they safe to use? So we'll give about a minute or so for any of those questions to come through. And then just to give you guys a little bit of background, so I am a dietitian stationed out here in California. I specialize in body composition. So what that means is that I specialize in the loss of body fat and the gain of muscle mass given different clinical conditions, right? So a lot of these injection and weight loss medications target into like my bread and butter, because I've studied, the process of losing the body fat and how that whole process works extensively. I've been in this industry, oh Lord, since I was 20. I'm 38 now, did the math, 18 years. Gosh, I'm dating myself. So without further ado, let's go ahead and get started. So just to give you guys a little bit of an overview, this is what we're going to go through today. We're going to go through the list of weight loss drugs that are being utilized out there, how they work, like, how do they actually, work inside of your body? What can we expect from them? We're going to compare that to the conventional or normal weight loss methods, right? We're going to look into see what's going on out there without. There is a nutrition protocol for every medication independently. So we're going to lightly go in through those, and just in case any of you guys may be starting or have started some treatment with your doctors already. So there is a different protocol that can greatly enhance the results that when you're using these medications. So I'll go over a few of those. Then we're going to talk about terminating drug use. What happens when you're done losing the weight that you want to lose? What can we expect? What does the research show us? We're going to go through all of that. And then are there any long-term consequences of using these drugs, right? Or even starting them, right? So we're going to go through what the research has shown us so far in terms of that, okay? So these are a list. These are all the drugs that have been approved by the FDA for essentially weight loss or the treatment of type 2 diabetes. So notice that there's very extensive list, right? The date of approval, if you guys see on the very right-hand side, there are a few out there that are very popular right now, like Ozempic, Mounjaro, Wegovy, all those things. Those have been recently approved. If you guys take a look at this, these are the years that the FDA approved them. Now, I know a lot of them, to some people, this causes a lot of excitement. To some people, it causes a lot of kind of worry. Like, hey, this injection. So think of like the COVID vaccine, right? Where a lot of us people were very hesitant to try it at the beginning. Other people jumped on board. So we're seeing the similar patterns with these kind of medications. By the way, quick note, I've put a little number on here in case you have a question about a specific slide. You can tell me which slide that is at the end, and we can revert back to it. Okay, so for the sake of this presentation, we're going to focus on two types of specific of medications. These are the ones that normally are being utilized for weight loss. Okay, so we're going to look at tirzepatide, which they go by the name of Mounjaro and Zepbound, and semaglutide, which is Ozempic, Wegovy, and there is a tablet form, not an injection form of this drug called Rybelsus. So we're going to go over these medications now. In specific, I want you guys to keep an eye out on two different compounds that are what make these medications so effective. One is called, it's a big fancy name. I'm just going to call it GIP, okay, to not stress you guys out. And the other one, I'm going to call it the GLP-1. You guys probably have heard GLP-1 a lot, and you're like, what is this? What does it even do? So I'm going to explain that in just a minute. So the main difference between the two, by the way, between, let's say, Ozempic and Mounjaro, right, is that tirzepatide in comparison to semaglutide, right, this one right here is only a GLP-1 agonist, right, where this one has the GIP activator, if you guys want to look at it that way, and the GLP-1. So I'm going to highlight that difference. This GIP-1 is the main reason why this tirzepatide was approved for the purposes of weight loss only, right, in terms of what it does inside of our body. So we're going to see why this one, and remember, the only one that has been approved in terms of weight loss out of the tirzepatide is Zepbound, and this one was approved last year in 2023. Okay, all right, so let's go to the next one. Next slide. Okay, so how do these work? Okay, so I'm gonna go over that GIP and the GLP-1 a little slower so we can understand what they do. What do these compounds do and why are they causing us to lose weight? Okay, well, the GLP-1 receptor, it acts like a similar hormone, okay, that causes the release of insulin when we eat, okay. So upon us eating, your body's going to detect glucose and fats primarily for the release of insulin, okay. And what happens is that this GLP-1 molecule causes your pancreas to release more insulin. Okay, I'm going to explain in a little bit why this is so important in terms of fat loss, but just know that on one end, this drug is causing the pancreas to release more insulin. Okay, this in turn reduces blood glucose, so your blood sugar tends to lower because of that. Okay, because of the increase the insulin production on that. Okay, so now another reason why this is so important, or why this medication is working so well, right, is because it's not just signaling the pancreas to release more insulin, it's having an effect on your stomach and your brain as well. Okay, in your brain, it kind of signals your brain that you're feeling full, so that's why people tend to eat less when they're on these medications. Okay, and it does something called delaying the gastric emptying. So in the stomach, there is a rate, or how fast the contents of the stomach, so your food, goes into your intestines, and it's in your intestines where this food gets absorbed. Okay, then remember that the purpose of the stomach is to break down the food, and the purpose of the intestines are to absorb that food, the nutrients in that food. Okay, this diagram, I love that they came up with this one right here, because it kind of really goes into what we know about what the drug does and what we also don't know what it does, right? So if you guys look at this, so once again, we're going over the pancreas. It helps with insulin secretion, right? It helps with glucose control. I'm going to talk about what it does in terms of your actual fat tissue, your adipose tissue, okay, in just a second. Right, we see this weight or appetite management in the brain that signals that you're not so hungry. Okay, and there is some evidence that these drugs are having an effect on tumors. We don't know yet what those are. Some studies have shows that it actually increases the presence of tumor cells, especially in the thyroid gland. Other research reports have shown that it doesn't have an effect in them. So we're going to look at that just a little bit in terms of the negative or positive effects that the drug has. Now, where we don't quite know what's going on is in the muscle cells and the liver and the kidney. There are some things, we are seeing some things with these medications, and when it was approved, the research was inconclusive as to the effect. There is one that actually showed it showed pretty consistent throughout a lot of research reports, but there weren't enough research reports to say, yes, in fact, that actually does this. But we can deduce from what we know about the human physiology, so how the body works, that it's having this effect. So we have yet to prove it through research, but we can kind of deduce from previous research when studying the muscle cells what it's doing to us. So we're going to go over and look at GLP-1. Okay, so this little guy is what's making Mounjaro and Zepbound so effective for weight loss in comparison to Ozempic, right? Or semaglutide, right? The reason for this is if you see the GIP, okay, molecule, it's also having an effect on that insulin secretion from the pancreas, right? It's also having an effect on the gastric emptying, so this slowing down right here. Later on, I'm going to explain what this condition is and why we're seeing this condition also appear in some people. Okay, so essentially, it's slow by you slowing down your gastric emptying, or how fast the content of your stomachs go into your intestines. It delays the feeling of hunger, right? Because your body's sensing, hey, we still have food in here, so there's no need for us to eat more because we still have food in here, right? So your brain is kind of getting two different messages that, hey, we don't need food. One from the receptor actually attaching to your brain cells, and secondary from getting a second feedback from your stomach. Your stomach has nerve endings on top of it that are connected to your brain that signals when the stomach is what we call distended, or puffy, bloated, big, right? That's also why when you're bloated, you may not feel as hungry. It's because those nerves are being activated in terms of that. Okay, now this one right here, when we looked at it through research, when the medication was approved, this was the aha, we can use this for weight loss. So it looks like GLP-1 has a big impact in what we call fat deposition. So that is the taking fat up out of the fat cell and the coming in of fat into the fat cells. So yes, essentially what this drug is doing, it's helping the fat come out of the fat cell for utilization so we can use that energy. Okay, I'm going to explain in a little bit why this is so important to know if you're already taking the medication to ensure that you're not, sabotaging yourself and that, weight is coming or that body fat, that fat that's been released into your bloodstream is going back into your fat tissue or your fat cells. Okay. Alrighty, so the glucose response. So in this one, we're going to look at, this is a picture or a diagram that I often write up with my patients, and I'm going to go step one by one to let you know how it all works, because this is the main reason or the main concept of how insulin has an effect on weight loss. It's because insulin has an effect primarily in your fat cells and your muscle cells. So all of the cells in your body, by the way, have insulin receptors, okay? But there are two types of cells that have more insulin receptors than others. And these are going to be your fat cells and your muscle cells. So I'm a very hands-on teacher, presenter. So I'm going to go ahead and stop this one right here. Oh, I'm going to go back. And I'm going to actually draw this diagrams for you guys to understand it. Okay. So in all of us have, if we pretend this is like our blood and our arteries, all of us have a range where our body likes to maintain our blood sugar at, okay? This range, how wide or how narrow it is, it depends on a lot of different factors. How much muscle you have, how much, whether, there's been a history of diabetes, so genetic factors, right? Whether you work out often or not, right? All of these will make you either more insulin sensitive or insulin resistant, okay? Now, up here, we call this the high blood sugar range, okay? Your body does not like to be up here, okay? Down right here, we have the low blood sugar range. Your body does not like to be at either extreme. Remember, your body is happy being right here, okay? Now, the normal response when we eat, okay, when your body eats and your body starts using that food, your blood sugar begins to drop, okay? Theoretically and technically, we get the cue for hunger. And technically, at this point, we're supposed to eat, right? So our blood sugar comes back up. We get the feeling of satiety and fullness. Technically, we're supposed to eat, stop eating, okay? And the same cycle happens over and over and over again throughout your waking hours, okay? The hours that you're awake, not the hours that you're asleep, okay? Your body behaves very differently during your sleep than when you're awake. The best place where you guys can see this is in infants and babies. If you look at them, they eat about every 2 to 3 hours. Okay. And biologically, we were meant to need food, that often because your body, your stomach can only hold so much food before it goes, hey, I've had enough. Let me use it. I've had enough. I've used it. Right. So we see that these cycles happen in 2 to 3 hours. Now, we as adults, right, we have the ability to override this process in this where a lot of jacking up can happen, right? Because this is often what ends up happening. So let's say we get the cue for hunger, right? And we have a meeting coming up, or we're busy, or for whatever reason, so we'll eat later, right? Your blood sugar keeps on going low. Now you're what we call, in the low blood sugar state. And this is where a lot of symptoms kind of come about. Being hungry and irritable, AKA hangry, right? This is where we get this term from. Some people start getting shaky. Some people start getting blurred vision, headaches when they're hungry, right? Everybody has a different amount of symptoms that they experience, and they feel them at different intensity. So that really depends on your biological makeup. Okay, so we remember your body does not like to be here, right? So what does your body do? Your body tries to correct itself and bring you back into this range right here. Now your body's going to crave things that are high in sugars, and specifically simple sugars, because your body wants to bring you back quickly up here as quickly as possible. Okay, so this is where you're going to be craving things like sweets and stuff like that. That's where this craving comes from. The fact that you're craving those things doesn't mean that you're lousy, doesn't mean you don't have enough self-discipline. It means that your body's technically working the way it should. Remember that everything that our bodies does, it's out of survival, right? We have a lot of different survival mechanisms in place to help us survive, right? So when I tell people that, hey, your body's actually working the way it should, although this is not the way we want it to work. And this is why we don't want it to work this way. Because when you're very hungry, right, you are going to often miss this cue for satiety. Okay, you're going to eat foods that are high in sugar, or crave things that are high in sugar, and most likely eat them too, and things that are high in fat. Why high in fat? Because your body says, hey, we've gone a long period without food. Let's eat the macronutrient that we know has the most amount of energy. Fat has 9 calories per gram, whereas carbs and proteins have 4 calories. Okay, so the body's actually very, very smart that, hey, whenever I get fast, I can go longer periods of times without food, right? Because it takes more time to break this down. Now, not ideal because we missed it, right? And then what happens? Once again, your body does not like to be up here either. These are what we call hyperglycemia states or high blood sugar states. And your body then again tries to correct itself and bring it down to here. Okay. How does the body do that? Okay. In here, this is where the brain talks to a little organ that looks like a leaf called your pancreas. Okay. Your pancreas then releases insulin, that little hormone that we were talking about. Now, remember, insulin, okay, is going to go towards two different places. It's going to go towards either, well, all of your cells, right? The fat cells and muscle cells. While we would love for our bodies to give this extra energy to only muscle for us to use due to energy, in a regular working human body without the presence of disease, without the presence of medications, right? Your body actually favors the fat cells because the fat cells were meant for storage. Okay, this is why a lot of times people, go prolonged periods without food and end up gaining weight over time. This is how, and this is why it happens. Okay. Now, there is a period of time, however, where the insulin favors the muscle cells, but that in a normal state, right? That's normally only happens in a 2-hour post-workout window. So yes, after working out, okay, and usually, any type of workout, but specifically resistance training, right? Your body needs insulin to rebuild because insulin is what we call an anabolic hormone, a building hormone. It helps to build fat, but it also helps to build muscle, right? So your body says, hey, I need more of this insulin to help repair the muscle that we just torn down. So it's during this 2-hour window period that your body will actually favor the muscle cell and give the insulin mostly to the cell for this extra energy, right, to come back down to the regular range. Okay, this is where the injections come in though. So what the injections do and what the medications do, it's they force insulin to go into the muscle cells when it's theoretically not supposed to or not meant to do it, naturally. And it's going into the fat cells to help the release of fat from the adipose tissue. That's just for the ones with a GIP, so Mounjaro and Zepbound, not Ozempic. Okay, so remember Ozempic or semaglutide. So Ozempic, Wegovy, and the Rybelsus one. That one only has the GLP-1 receptor. Okay, the one that makes you feel full in the brain, right in the stomach, all that stuff. Okay. Alrighty, so we're going to come back to this diagram because this is how later on we're going to see where we see some of the side effects and how some of the negative effects are coming about, right? But essentially, this is what the medication is doing, right? The medication is having an impact on your muscle cells to take up more glucose, more insulin throughout your day, so you can use it for energy and let in more of this energy coming out of the fat cells. Okay, so I'm going to go back to right here. All right. So now that you guys understand how this works, okay, let's keep going. Okay, so now let's look at when a lot of our patients, and I'm working with a lot of providers in terms of educating our patients on how to properly use these medications. Before that, I usually have a consultation with them and with their provider, right, for them to explain how the medication is actually working and what is the cost of them, not just the financial cost. We know that these medications are pretty costly, right? But what are some of the other costs, other effects, and consequences that we can see from these, from these drugs? We see that it alters your physiology, right? Remember how I said that, the medication is forcing, your body to do something that that it's not meant to do in terms of using the insulin towards the muscles and the fat cells, right? Now, one of the things that I really, 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 if you can take one thing away from this whole presentation, this would be it. who are these medications meant for, right? These medications were not meant for the general public. I'm going to break down onto, if you are a candidate for these medications, how to properly use them. Okay. And if you're not a candidate, what can you expect in terms of what effects can you expect from them, from the medication happening to your body? Okay. Some side effects that we can see from long-term use and possible conditions that you may end up with. We don't know whether these conditions are permanent or temporary. There's not enough research because these medications have been recently approved. So there hasn't been enough time for us to look into see how they're affecting the human body. So pancreatitis, which is the inflammation of the pancreas. Remember, we're forcing the little guy to work overtime. So yeah, he might get irritated literally and get inflamed, right? Gastroparesis. So going back to this one right here. So gastroparesis is when all of a sudden the muscles in your stomach and your intestine actually literally start to slow down by themselves. So not just with the injection, but it seems like their muscles can get stuck, and now you're not moving the contents out of your stomach at all, or just very, very, very slowly, more slowly than we would normally see, right? Bowel obstruction, right? We're seeing that a lot of people are, having bowel issues. They're feeling constipated, having gallstones, and all these things that can come from things getting backed up, right? So we need to make sure that we're properly utilizing these drugs for the people who they were meant for. So let's look about that. Who were these drugs meant for, and how do we know who should use them? Okay, so let's look back again at, these are going to be your semaglutide ones and your Mounjaro and Zepbound. If you look at Ozempic and Rybelsus, they were only made for the people who have type 2 diabetes. So guess what? From a professional standpoint, if you do not have type 2 diabetes, you should not be considering these drugs. However, if you do, by all means, do talk to your provider. The reason why these medications were meant for the type 2 diabetic person, right, is because their physiology, so their weight, that their body works, has already been altered by the disease. So if you guys remember that little diagram where I wrote about the insulin, right, that connection, those pathways have been altered to some extent. I don't want to say destroyed, but they have been jacked up, if you would, right, because of the disease. So we got to be very mindful in terms of who we're listening for. I have had multiple patients use Ozempic and these with very positive outcomes. So I'm not saying that the medications are bad or anything. I'm saying let's use them properly. Mounjaro, I've actually had quite a lot of fertility patients use Mounjaro who have PCOS and who had fertility issues, and they in fact now are pregnant. So congratulations to those people out there, right? So we see that if you look at the way things are working, right, there is a potential benefit to them. So now let's talk about in terms of weight loss, right? Who were these two medications that were meant for weight loss? So that's going to be your Zepbound, right, and your Wegovy. Those are the ones that were approved for overweight and obesity. But it gets more thorough than that. Okay, Mounjaro was also for the type 2 diabetes. Now, the reason why these were also meant for the type 2 diabetic person is because an underlying condition of type 2 diabetes is what we call insulin resistance. Okay, so if you have insulin resistance, right? So for example, some PCOS patients are not diabetic, but they have high insulin resistance, right? In which case, that's why they consider them candidates for these conditions, right? So that's why I say it gets very complex in terms of who should or who should not use them. I feel like if you guys become educated about your own body and your own the potential benefits or drawbacks of the medications, now you can make an informed decision whether to go ahead and use these medications or not. Okay, so in terms of overweight, it gets, like I said, it gets a little bit more complex. Let's look at that. So this was the release from the FDA in terms of Zepbound. Remember, Zepbound was the one approved for weight loss, but not just for weight loss. So if you needed to lose weight by itself, that wasn't enough to consider you a candidate. You had to have some kind of overweight or obesity determined by the BMI factors, right? With at least one weight-related condition, such as high blood pressure, type 2 diabetes, or high cholesterol. So if you classify under the BMI category of overweight or obesity, and you have one of these three, then you are a perfect candidate. These medications were meant for that person. Okay. If you say, Karla, well, I don't have high cholesterol, I don't have type 2 diabetes, and I don't have high blood pressure, right? Can I still use these conditions? Well, just because we can doesn't mean that we should. Once again, let's just go over what the medication does, and then you be the decider, the person who decides whether that's for you or not, right? Remember, us as healthcare professionals, my job is just to inform people of the science, translate the science in layman's terms, and have you decide. It's your body ultimately. You're going to reap the benefits or the consequences, right? And that's how people, I feel like, should be informed in terms of how to make that decision or not. Okay, so let's compare this, right, in terms of our conventional strategies for weight loss, right? Once again, 95% of my patients are for fat loss, right? But once again, they all have different multiple conditions. So the strategies that we use very different from condition to condition, person to person, culture to culture, right? There's a lot of individuality work that goes into treating a patient, right? Now, normally the regular way in which people lose body fat, right, lose weight, right, is through a calorie deficit. So you guys might have heard the term of less calories in, more calories coming out, right? So whenever you have that calorie deficit, less calories in, more calories out, you're gonna lose weight. What determines whether the weight that you lose is body fat, it's a proper macronutrient distribution. Because remember, when you step on that scale, right, that number on the scale is the sum of 4 different types of weights. Okay, it's your water weight. We as human beings are made up about 70% water, right? We have your bone weight. Your bones are gonna weigh. If I grab just your skeleton and put it on the scale, that's gonna weigh some, right? What's called your lean mass. So this constitutes everything from your muscles, your organs, your skin, all that jazz. Okay. And then your fat mass, which is going to be your fat tissue or the squishy stuff that causes the cellulite and we want to get rid of, right? So once again, this proper macronutrient distribution is what's very, very important in order for you to lose body fat. Okay. Now, this proper distribution differs by medical conditions. Some people, depending on where they're at or how their physiology is working, may need more carbohydrates. Some may need more, more fats. Some of them may need, substantially more protein. So once again, it really depends, and that's when we look at people more in an individual case by case to determine what this distribution is going to be. Okay, let's go back and let's go look at the calorie deficits and what happens to that fat cell, okay? By the way, your body will naturally tap into the fat cells just the same way the medications are making your body do it. Remember, so these medications are making your body do what it already does, just at a multiply, 1,000th, % extra, right? So that's what these medications are doing, okay? Now, remember, the goal of a calorie deficit, okay, and the goal of weight loss in terms of fat loss is going to be to decrease your gastric emptying, so slow down that rate of the contents going from the stomach into the intestines, right? Increase your energy needs so that your body goes, hey, I need more energy. But if you're not giving more energy through the food, where do I grab that? Well, that energy then is going to be grabbed from the fat cells. Okay. Once again, your body will naturally do that. Okay. And then this is the hardest part, right, to achieve and maintain consistency. Once, our patients have shown us they can lose body fat, I'll tell them, okay, now you're about to enter the hardest part of the journey. And that's just to do it over and over and over and over again. Remember, you guys are not robots. You guys don't have a fat melting button that I can just push and the fat will melt off, right? We then need to achieve this all over again with different foods, different, styles of living, whether it's the holidays, whether you travel, right? And it all can be done, right? This is what we call, transition into a different type of healthy lifestyle, right? So that's where we talk about that lifestyle change. Okay. Now, the delaying of the stomach contents into the intestines can naturally be delayed by eating more fiber. This is why it's really, really, really important for people that are undergoing or they're trying to lose body fat to have a lot of fiber with the foods. Now, remember, this is for the people that are trying to lose body fat the conventional, their normal way, right? Because if the medication is already causing you to delay your emptying, to slow down that rate, you don't want to do something to even further slow it down. So there's an actual amount of fiber that we recommend, and once again, that really depends on a case by case, because now we have to see if the patient has overweight, diabetes type 2, in hypertension, and then which foods can fall into the category, right? Or other means of clinical conditions that we have to detail their foods by. Okay, but it can naturally be done with fiber. If you're trying to do it the natural way, what we recommend for women, it's the intake of anywhere between 25 to 30 grams of fiber per day. Okay, for men, it's 35 to 40. Okay, so making sure that you take all that fiber. Usually the taller the woman is, the more fiber that she'll need. Shorter women would tend to be a little bit smaller, so we have less needs for that. So consistency is what's going to be key here. All right, let's keep going. Okay, let's talk about these nutritional protocols, okay? Because like I said, each different one has a different condition that they're targeting, right? So remember, the semaglutide, which is your Ozempic, is going to be just with your type 2 diabetes, right? That's what they were intended for, right? The step-down was going to be for your overweight with type 2 diabetes, overweight with hypertension, or overweight with high cholesterol, right? And the Manjaro, that's going to be your type 2 diabetes. Now, usually the goal here is to bring down your calories as much as we can, right? And that this number that we try to get close to, it's what we call your RMR, or your resting metabolic rate. If you were in a vegetative state, a state of coma, right? And you were laying there doing nothing, right? Your body would still need an X amount of calories to survive. That's because your heart still needs to pump, your brain still needs to tell your organs what to do, right? And all that jazz, right? So we try to get as close to this number as possible, right? Because then the thought is that whatever other energy your body needs to move around, to talk, to move your hands, blink your eyes, right? It's going to get it from the body fat, from the energy stores, right? That your body has, that excess body fat in, okay? Now, remember, your body still needs a specific amount of carbohydrates, a specific amount of fats, right? And it's usually carbohydrates that have, or the overconsumption of carbohydrates that have led to insulin resistance, right? Now, you need carbohydrates, okay? Your brain alone, the adult human brain, needs 130 grams per day, okay, to function. Okay, your brain cannot function out of anything else other than glucose. Your brain and your nerve cells are the only things in your body that absolutely need sugar and cannot function out of anything else. Okay, now the degree of insulin resistance. Okay, so how well insulin is working in your body or not. Insulin resistance, the way we explain it, is how insulin attaches to the cell, and for that cell to open up and glucose to come into the cell to then be used for energy. Okay, with insulin resistant patients, that process has been altered, has been jacked up, or whatever you guys want to call it. And usually people with insulin resistance, the insulin is not attached into the receptor well or at all. And if it's not attaching well, it's probably sending a very weak signal where it's not letting that glucose come in. Okay, so the degree of insulin resistance, right? It's what's going to let us know how many carbohydrates you can consume in a day. We can tell, like in the clinics that I work with and with the patients that I work with, right? We can tell how insulin resistant you are by looking at the insulin in your blood, so serum insulin. Okay. Okay. Once again, a different approach is used with Ozempic and these other semaglutide drugs, because there's that GIP is not being activated, right? So that GIP, we know that the big component is that it was, making that fat come out of that fat cell, right? And that's one of the things, that's where exercises, really comes into play. Whenever you work out, specifically resistance training, okay, you elevate your resting metabolic rate. That is or your metabolism, as some people like to call it. This is the only things that has been proven by research that can naturally increase your metabolism is through resistance training. The reason for that is because after you work out, after you do resistance training, you cause micro tears in that muscle, and your body then needs energy to repair that muscle over the period of the 2 days after that. Okay, so your body goes, hey, I need to repair something that I normally would not have done in the past. So this, extra need for energy is where that increased metabolic rate comes from. Okay, want to make sure, I know I'm zooming past this, I want to make sure I give you guys enough time for questions. Okay, so let's talk about now about terminating the drugs the drug use and what the research report tells us so far. Okay, so cessation therapy, and we see that we are seeing body weight regain. Now, cessation therapy is when you slowly taper off the medication. The reason for this is when you first get your medication, right? Normally, the way the FDA approval got, the protocol for the use of this drug is that you would slowly introduce this, chemical compound into the body. So normally, your doctor would prescribe a 2.5 milligram, increase it to 5 to 7.5 to 10 and up to 15. For the research that got this medication approved, the best results were shown at the 10 milligram dose. Okay, so a lot of the time that's like our goal. Now remember, everybody's different. Some people might see better results at 5 milligrams. Some people might see better at 7 milligrams. Once again, no one body's the same, and we have to take that into consideration. Okay, but multiple studies since these drugs have been approved have shown that the regain does happen, right? What we see in the reports is that about 16% of the patients that use these medications can keep the weight off without using the drug long term, okay? And about 84% will regain the weight back without the use of the drug permanently or for a very long period of time, right? I don't want to say permanently, but for a very long period of time. Now, we don't know why this is, by the way, okay? One of the things that come to mind as a clinician, right, to me is, okay, is it because this medication is altering, your physiology permanently? Your body functions out of a feedback loop. Let me give you an example with lactose, okay? If you don't eat foods with lactose, okay, so lactose is the sugar in the milk, you will become lactose intolerant, right? Because your body goes, well, hey, I don't have the need to make this enzyme because there's no need for it, right? So I'm just going to stop making it. So if you stop eating milk products, you will become lactose intolerant, right? We often see this with people that have gone vegetarian or vegan, and then they revert back to trying to consume lactose products or milk products, and then they experience a lot of abdominal pain and stuff like that. You can revert and become and not be lactose intolerant, but you have to go back and do it slowly, right? You can't just abruptly shock your body, right? So once again, we don't know if similar things are happening with the use of these drugs, whether they're temporarily changing your physiology or permanently changing your physiology, we don't know. Another thing that we can deduce is that the medication or the injection by itself, it's not solving the root cause of the problem, right? So a lot of the times people don't understand how they gain weight in the first place. And that is the underlying root cause, right? If you revert back to your old way of eating, prior to using the medication, well, yeah, you're going to revert back to your old weight, right? So I often explain this. Let's say, you came into the clinic with a broken bone and a bunch of scrapes, and you were like, oh my gosh, I don't like the way the scrapes looks. And then the doctor gave you a Band-Aid. Okay, the injections are like that Band-Aid. But, just because you put a Band-Aid over the thing doesn't mean the bone is, being corrected. Now, you can use both. You can, put a Band-Aid and put a cast on, right? And we definitely have seen people, like I said, who have been successful. And this is one of the reasons why I clicked, because I want to make sure that throughout the use of when people are using these medications, we're looking at which factors led them to gain weight in the first place and make sure that we learn how not to have those again. Okay, so I would say that's where, if I were to guess, that's where we need to actually change or help our patients change in a permanent way. Okay. Successful maintenance. So we do see patients who stay on the use of a weekly 10 to 15 milligram use. By the way, 15 milligrams is the maximum tolerance that has been approved for this medication, but people who stay on this medication for, for long periods of times. So, some people will say not forever, but essentially for a long period of time. Using this weekly, they are able to maintain their weight off, which makes sense. If that's what make them, lose weight in the first place, staying on this drug will make sure that the weight, gets reutilized and stuff like that. I'm sorry, the body fat gets reutilized. This is another reason why we emphasize, nutrition and the feeling of fullness, through the consumption of fiber or foods that contain a lot of fiber to help combat the increase of ghrelin. So ghrelin is your hunger hormone, right? So as soon as you stop eating, using the medication, remember the medication is having an impact in your brain and how full you're feeling. Okay, the minute you stop using it, ghrelin, which is the hormone that tells you, hey, we haven't had food in a long period of time, this hormone is going to be released at high amounts, and you might have the feeling of intense hunger. So we want to make sure that we are accounting for that, right, and reintroducing food back slowly to fit your needs, your what we call energy needs, right? What your, the amount of food that your body needs in order to do everything that you do on a daily basis. Okay. Long-term consequences for each of these medications. So in terms of the tirzepatide, Mounjaro, and Zepbound, we don't know. These medications were recently approved, Mounjaro back in 2022, and then Zepbound last year, right? So we just don't have enough research to say what the complications are going to be, right? For semaglutide, specifically Ozempic, right? Because Ozempic seems to be the preferred drug for this, the preferred brand used for this this drug. It was, like I said, approved back in 2017. So we do have a little bit more research on that. And here's what we've seen so far. In the available research that is out there, we do see a similar trend to those of weight loss surgeries. So, for example, when people get the gastric bypass sleeve or all the surgeries, we do see those patients revert back and regain most of the weight back after the surgeries. Once again, that's because they now need to learn how to not gain weight with a smaller stomach, right? So once again, going back to that lifestyle change is going to be very, very important for anybody, whether they're using the medication or whether they're going through an actual surgery, right? The once again, possibility of reverting back to old patterns. Remember, the injection is changing your physiology, not your behavior, right? And then it is showing that there is a regain of weight. Once again, as to why exactly, we don't surely know yet. Usually long-term studies are done on things that can be studied for 50 to 20 years. So this drug just hasn't been around long enough for us to study it in terms of the long-term effects. Okay. So my references, in case you guys wondering where I get some of the information from, feel free to to read any of them. And if you guys have questions, please by all means reach out. And now this is where we get to the point where let me know if you guys have any questions. I would love to answer them. In the QR code, by the way, there is a link to schedule a 20-minute free consultation for everyone. If you're using the medication and you're just wondering if you're going in the right directions, please, I'm here to help any way I can. But I would love to answer any questions if anybody has them. Questions? Let me go here. Let's see. Oh, let me actually keep that too, just in case. I know some of you guys are still taking pictures of the QR code. But yeah, like I said, we definitely have seen a lot of success stories with the utilizations of the medications. So really depends on your own personal case, right? Making sure that you guys are following the nutritional protocol with each medication, and make sure you're paying attention to those lifestyle changes. I think are going to be your best predictors of success. All righty, if no other questions, this concludes my presentation. I'll definitely hang out. Oh, I see the questions coming in. Thank you guys for everything. Like I said, I'll hang out. If anybody wants to speak to me really quickly, just some more one-on-one. But thank you guys. Thank you guys for joining on. I hope this information helped.